As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission, I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain, keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up, yeah.
You're listening to the Tom Ficklin Show on WNHH-LP 103.5 FM, your home for community radio.
Good morning, everyone, and good afternoon and good evening. I just wanted to mention that Kristen Bold, B-O-L-D, will be joining us shortly, and she's a clinical psychologist with expertise, quite significant expertise in substance use treatment and research. Earned her doctorate at Rutgers, State University of New Jersey, and completing a pre-doctoral clinical internship as well at Yale, and has been promoted to the research faculty here at the Yale School of Medicine in the Department of Psychiatry. Her program of research, and I like that phrase, program of research, because it's an ongoing endeavor, and not just something that's on the bookshelf, but her program of research focuses on understanding cigarettes and e-cigarettes and the use among youth and adults to inform tobacco prevention, intervention, and policy, especially youth tobacco use. Her research really takes the deep dive and the very important deep dive in terms of youth tobacco use, including the U.S. Surgeon General's report on e-cigarette use in young adults. She has a variety of research activities and interest in clinical trial designs and implementation that she's involved with, which we'll discuss in a few minutes. So she'll be joining us, and really looking forward to the discussion with her. Just clearing my throat here. While we have a minute or so, let me just say that some of her specific research activities include why do young people start in terms of the initiation of smoking, and then the just as important question of how do we help people stop smoking? What cessation efforts, and cigarettes and e-cigarettes and vapes and hookahs are addictive, right? So what are we just continue to pump poison into our body, literally our youth body politic? She also talks about in her research mobile technologies and wearable biosensors, where people can kind of get some tactile feedback when you've heard about patches, et cetera. But how can technology help with smoking cessation? Clinical trials, she's very much involved with designing clinical trials, which are always needed. I like to say clinical studies on the effects of potential tobacco and regulatory policies. And again, just the overall arching issue of addiction. Why are we encouraging people to be addicted, and not only encouraged, but manipulated, should I say? And then, as I say, expanding smoking cessation services. So she will be with us shortly, and just hang in there. Hope everybody's having a great day. Here's Christian now. Christian, how are you?
I'm good. How are you?
Good. I just gave a brief introduction because I knew you would be timely. So really appreciate your being available this day. I always kind of kid to myself, and sometimes even mention on air, Christian, that tomorrow it's tomorrow in Australia, right?
Yeah.
So this man and women's invention of time is just fascinating. I'm not sure when that took place, but I'm sure I have to look up that historical trivia point. Let's do you have a glass of water or tea? Or are you ready to go, or did you have lunch already?
Yes, I did. Yeah, thanks so much.
Great for you. Great. Christian, I was looking at your bio and we talked a little bit before, and you've heard me stutter, scream, yell, moan, cry, and pray about where are we going with poisons that are being available on the market. But let me not be so dramatic. Uh, I mentioned people in the intro about your clinical research. So let's just start with there. And let me start. Can I start with if not the hard question, but the question that I just continues to kind of go around my mind, which is, are cigarettes, tobacco, hookah, uh, vape, e-cigarettes, blunts, cigarillos, are all of those items addictive?
Yeah, that's a great question and a great place to start. So, any tobacco product that contains nicotine is highly addictive. So, nicotine is really that chemical that's in the tobacco product that leaves the body and brain wanting more. And nicotine is so highly addictive. And I think that's really where a lot of the problems start is that so many young people are using these products for the first time, maybe not knowing what's in it or not really thinking much about it. And then many go on to develop nicotine dependence and continue to use products. And we know that, cigarettes in particular are the leading cause of preventable death and disease in the US. And so that's really where this becomes a passion of mine, because if there was a single thing that we could do to help people, this is fully preventable. Being able to prevent the number of deaths and disease and the impacts that occur. It's about 1 in every 5 deaths each year are totally preventable and are totally attributable to cigarette smoking and secondhand smoke. That's where, my work as a clinical psychologist, providing treatment to people to help them stop and help them quit using, and also the clinical research that I do is so important to find ways to improve tobacco treatment and inform policies that can really reduce tobacco use and the harms of tobacco use.
Let's talk a little bit about, and I really appreciate you being as expansive as you just were with your scope of interest. And I was on a brief phone call prior to this show. A friend had called, and his friend was just really mentally disturbed about the current domestic and international political situation. And so my question is, in terms of, you're a clinical psychologist. Let's spend some time about this, your thoughts about, and research and experience about the mind and what makes people addicted. Why are some of these things make them feel good? Just where is your field headed? Even if these products are available as they are, I hear you also saying that people could make the mental decision not to use them, but people make the mental decision to use them. So share with us a little bit about clinical psychology and your field, and where is it going? Are you guys trending? Are you finding some new solutions, new methodologies, technology? I'm just curious where you see your field uh, trending, given your commitment to this particular discipline of
Yeah.
clinical psychology.
Yeah, absolutely. And so tobacco use, I think, is a really great case to talk about here in terms of how it affects the brain, how it is influenced, and how the behavioral piece of it, right, that we think about as psychologists. And so, as I said, it's really that nicotine that drives the body and the brain to want more. Nicotine is gives a little boost of dopamine, right? So in your brain, you get this little pleasurable sensation of wow, a lot of great feelings all at once. And young brains, youth, teens who are using products like this for the first time are really vulnerable and sensitive to that reward process, right? Their brain lights up in a big way. And so what we know what happens over time is then, when the nicotine leaves the body, there's a little bit of withdrawal, a little bit of craving that happens, and then so somebody will use again to alleviate that craving and withdrawal, and kind of a vicious cycle continues. Um, and so there's both kind of the nicotine parts that keep the body and brain wanting more, and then the behavioral parts, right? All the other aspects of the product can influence the use of it, and we'll talk a little bit about what some of those are, as well as just the people, the places, the environment, right? And so, I think it's important to recognize that there's a lot of shame and a lot of stigma, I think, oftentimes around people who smoke and feeling like, well, gosh, it's so hard to quit. And why am I still doing this? And I also like to emphasize that, it's not any one individual's fault that they're doing this, right? There's a reason these products are so addictive. And it's really by design. The tobacco industry has done tons of research to understand what makes a product appealing, what makes a product easy for people to inhale and easy to use, and what are the nicotine levels that make someone want more. And so I think a good case and example is with menthol as a flavor that's been added to cigarettes. And I know we'll talk a little bit about what that impact is, and that's a big part of the work and the policy interest that I have, because we know that menthol is a cooling chemical, a cooling flavor, the same thing that's in cough drops and things that kind of helps alleviate a sore throat, right? It makes it less irritating when somebody inhales on a cigarette. And so what does that do? It means they can inhale more deeply. It means it's easier for somebody who's never used a cigarette to smoke a cigarette. And so most youth who are smoking cigarettes for the first time are using a menthol flavored cigarette. And so we know also that over time, menthol also changes the brain. So I was talking about those nicotine receptors in the brain, and menthol actually increases the number of nicotine receptors that are in the brain. So someone, when smoking a menthol cigarette, is even going to have more of an effect than someone who's smoking a non-menthol cigarette. So it's also by design that it's a lot harder for people to quit these cigarettes because of the chemicals and the process and kind of the impact of menthol in these cigarettes as well.
Kristen, you said a mouthful there, and a good mouthful. But are you? My pause is for the remaining 45 or so minutes. I do not want in any way to put words in your mouth. But are you suggesting that the government or society or industry is poisoning us? And I thought government's role is to kind of protect us.
Yeah, that's a great question, and I'm happy to clarify. So the tobacco industry, the people who are making these products are trying to make them as appealing and as widely used as possible. That's their role. That's, capitalism. The government's role, and I think this is an important distinction. So the FDA has the regulatory authority. They can regulate, which means they can determine what products are on the market. And that's a big part of what they're doing. And a big part of the scientific and clinical research that I do is to help inform these policies, to say, what do we know about the science of these products? What does the research say? And what policies should we put in place to protect public health? And that's absolutely the goal. So the FDA has proposed policies to restrict menthol in cigarettes, for example. There have been a number of delays in that policy getting fully enforced and fully across the finish line, in large part due to opposition from the tobacco industry. So, I would say we're really at competing odds with the industry and public health, right? The industry being tobacco industry, and public health. I think we perhaps have very different goals.
I don't want to put words in your mouth.
Mildly.
I don't want to put words in your mouth, but again, I'm still a little confused if there's certain things that, like certain poisons, you cannot purchase over the counter, correct? I mean, just as a generic word, poison. And I hear you saying that this is a poison that is still legal, and that the government, through the FDA, proposed managing that their proposal has not been adopted or approved or accepted.
That's right.
Is that what you're saying?
Right. So the FDA has been really gathering all of the scientific evidence to be able to support a policy to go forward. And this is a long time in the making, and there's a number of decades of research that have been summarized to really show that menthol in cigarettes is something that is really appealing to youth. So causes disproportionate harm to youth and disproportionate harm to Black and Brown communities. So over 85% of Black Americans who smoke a menthol cigarette. And so really, from a social justice perspective, a huge need to say, we don't need this additional additive and this additional flavor in the cigarettes. And so that's, the work that I do and the other public health researchers and healthcare advocates. And so all of that has been supported and sent to the FDA, and they've developed this policy that's totally in line with that. Where we're meeting some delays and challenges is from the tobacco industry. And there's some pretty loud and vocal opposition to policies in general, to government regulation of things in general. And so maybe we can talk about a couple of those, because there's a few themes that I tend to hear in this opposition. And I think it's important to kind of break it down so that people understand what this policy actually would do and what the impacts would be.
Please, well, let's go there for terms of context and gestalt, as they would say, please.
Yeah. Well, so I think there's good evidence, we would not be the first country to do this. So we'll start there. There are a number of places where menthol cigarettes have already been banned. Other countries, Canada, the UK, and a number of others, and a number of states as well. So California, Massachusetts as examples. And we do see a lot of huge benefits in these places. We see a number of people making quit attempts, right? A number of people being successful in quitting. And just from a public health perspective at large, we have huge estimates about the numbers, hundreds of thousands of lives that would be saved. And over a third of those would be specifically Black and African-American adults, just given the high rates of menthol cigarette use. So, I think we have a lot of compelling evidence that this would be beneficial, right? And that's really what we're pushing forward, and why this there's so much support around this policy. So the opposition then comes in the form of a couple things. There's usually about three things that I hear. So one is concerns about the economic impact. We hear this at the local level. We hear concerns from store owners and small business owners saying, I'm really going to lose economic revenue, and concerned about how that will impact their livelihood. And so I think the key things to keep in mind regarding this are, so if menthol cigarettes are not available in those stores, for example, there's room on the shelves for some other commodity, right? What else could they be selling? So they might lose that revenue for the cigarettes, but they could sell something else. The money, the huge cost of what is being spent on cigarettes could be spent elsewhere in the store, right? And we know just on a global scale, on a much bigger public health scale, in terms of economic impact, if we really want to talk about economics, just the amount of cost for smoking related death and disease at a healthcare level. It's over $300 billion in the US each and every year, just due to smoking and smoking related diseases alone. So, I really think it's kind of a no-brainer in terms of the economic benefit of not having to care for the death and disease toll related to smoking. And so for me, it's a question of, how much are we really willing to trade off a life and health, for economic impact of, perhaps at a small scale that could probably be easily replaced. So that's one, and kind of, wouldn't we rather have a vibrant, healthy community, right? Where we can all contribute to the economy. The second opposition and the second concern that people raise is often about concerns about a black market, and saying, well, people are going to get the cigarettes anyway. And really, there's been no evidence of this happening in other places where menthol cigarettes have been banned. So I think we don't have a lot of concern that this would be a common or a prominent thing that would happen. And I think in part because of how the law and the legislation would unfold. So this ban really occurs at the manufacturing level, at the industry level. So it would say tobacco companies can no longer make, manufacture, sell menthol cigarettes. And so they wouldn't be coming into the market that way. And then I think this really ties into the third concern that I hear a lot, which is about kind of a loss of freedom, individual rights, and some really specific concerns people raise of, well, is this going to criminalize the product, right? Is there going to be a disproportionate impact in these Black and brown communities where people are smoking menthol cigarettes, where they have menthol cigarettes? Is this going to increase police targeting in these communities, right? And so I think this gains a lot of traction. This is a huge, scary concern, and it's a scare tactic that's really being pushed by the tobacco industry. Because again, we know the way the legislation would work, the menthol ban happens at the tobacco industry level, right?
Mhm.
The enforcement agency is the Food and Drug Administration. So they're going to go to the tobacco companies and say, you cannot make or sell these products. It's not the police who are doing the enforcement. It's not at an individual level. So it's not going to be criminalized or punished for an individual who would have access to these products. It really happens at a totally different level. And so, I think it's important to recognize, why we're having such hard time gaining big traction with a big policy like this because of a lot of the opposition that we're hearing. And then recognizing, where is this opposition coming from, right?
Mhm.
And in large part, it's a lot of big money and big donations going to key leaders and key people who have a platform. And the tobacco industry is funding a lot of this. The tobacco industry funds members of Congress. They fund lawmakers. They fund religious organizations, and they fund a lot of prominent people who then, are coming forward with some of these concerns. So I think it's kind of, as we break it down, I think it's important to recognize, where does the evidence actually
Mhm.
lie? And I think in strong part, in full support of this policy.
You've been, I'm sure people have said this about you, Christian, if I could be somewhat personal and call you by the first name, that you're come across as a, not come across, but you are, you impress people. If, let me spit it out. Have you been told for most of your life that people see you to be kind and compassionate?
Usually, I think that's why I'm drawn to healthcare
People,
and to something that is so passionate.
it's
Yeah.
clear that you're kind and compassionate, but are you saying that some people have been bought off, that money has caused them to turn a blind eye and to not care if people die by being supporting this service, this commercial service delivery? Are you saying that some people can be easily, people and industries and organizations can be paid to not care about black, if I dare say, Black Lives Matter?
Yeah, I think it's terrible, right? I mean, I think there is such an influence of power and money, and it's hard to see how that can unfold. And yet, oftentimes the tobacco industry just has such elaborate tactics, right? This isn't the first time that, they've done things to try and delay legislation or things like this, right? And so they really do find loopholes, they find places where money is needed, right? The tobacco industry funds HBCUs, for example, right? And there's real need and real benefit there. Scholarships and a number of things are put forth to support the community, but then at what cost, right? And so, I think it's always important to recognize we don't want to be turning away perhaps support. I think there's a question people have of like, well, all money is good money. Perhaps if we don't have other sources of support to, launch this initiative or do these other things, it does just feel so manipulative though, right? Like at what cost and what strings are attached to the money, I think is always a question that I have.
Share with folks, Christian, yes, again, in terms of the historical context, the there's been more than one Surgeon General's report, and the first was in 1968, 1969.
Mhm.
Share a little bit about folks, so folks can see that this, I want them to kind of see you as a sojourner. If I said sojourner, that's kind of a spinoff word, sojourner truth, a sojourner for this. But this battle is not news. It's just not menthol ban historically defined. Just to even just for the first Surgeon General's report to become public, if you will.
Yeah, exactly. Yeah, and I cannot take any of that credit, right? I am only here given a number of amazing and prominent leaders who've pushed through tobacco policy and all of these things to get here. So the first Surgeon General's report came out in the 1960s, as you said, and that was really the first time that people were aware of the link between smoking causing cancer and smoking causing a lot of harmful health problems. Up until that point, there were a number of ads saying, this is the doctor recommended brand of cigarettes, for example, which just feels so preposterous today. We wouldn't ever see that now, but there was a lot that wasn't known at that time. And so since that time, we've done a great job. And as I said, I can't take credit for it. There's been a lot of great work done to provide treatment, to provide education, to improve policies, to reduce the overall rate of cigarette smoking. And so we've made historic change and historic low rates of cigarette smoking even today. But we haven't really seen the same level of change in menthol cigarette use. It has not reduced at the same rate as non-menthol cigarettes. And I think in part due to some of what we were talking about, just of how insidious the menthol chemical is, and then also some of the really intentional tactics that have been taken by the tobacco industry of marketing these cigarettes, providing free samples of cigarettes to communities, really just infiltrating communities with these products, so that it's really no surprise that people are using these and then you become addicted and continue to use them.
I think I wished, did I wish you a happy Mother's Day? So you have a child,
Yeah. Mhm.
two, I believe, right? You said
Yeah.
two.
Yeah.
So
I guess.
two. If you were a Black mother and had two Black children, and I have Black mothers and Black children listen to the show,
Yeah.
hearing what you've just said, they may fairly come away with the interpretation that a particular industry has selected them for slow, I'll use the term slow genocide, but just slow death, or injecting or increasing the probability of their health incidences increasing, that a particular class and race has been focused on with laser-like intention. Are you saying that?
Yeah.
And so you can imagine the rage, the comfort level, the discomfort level, the anger
Hmm.
at when people hear about the menthol ban delay or hear
Hmm.
about the history of cigarettes. You can imagine that it's an emotional landmine that could possibly blow up in our face if it hasn't blown up in our faces or this already. Uh, in terms of it's difficult to reach any other conclusions than what you've already alluded to for these last 15, 20 minutes. What amazes me, and I want to come back to this, what amazes me is if menthol is really more addictive, and if you really are a capitalist, you'd want to have everybody. Why just target a slice of the pie when you could addict the whole pie? So the economic driver, quite frankly, to me, might not be the only impetus, but it might be something more deep-seated hatred or some uh, uh, racial calculus about why, if you follow me, if it was truly an economic motive to increase your market share and sell more product, you'll go for it. And you have a product that's global, you'll go for everyone, right?
Hmm.
So that still perplexes me just as a thought probe. I'm
Hmm.
glad you mentioned the other countries, Ethiopia as well, and Senegal.
Hmm.
So um, uh, talk to me a little bit about, and we have about another 15, 20 minutes about cessation, because even if you're involved with trying to encourage people to live a healthy life
Yeah.
and to walk that path. So
Hmm.
talk about some folks even today that will listen to this show and say, you know what, I gotta get off this horse. I gotta change. I gotta change stream. I must do it. What kind of advice, suggestions, where should they go? Talk about this because we still have to heal people, even that are being damaged as we speak.
Yeah, exactly. And so I think it's so important first, as I said, to kind of just destigmatize this, right? And it's not a personal moral failing, or I don't see it as a personal moral
Hmm.
failing that people smoke cigarettes. And it's no accident that cigarettes are so hard to quit, just by design because of the nicotine and the chemicals in them. And so, I think oftentimes providing information, education, platforms like this, just to tell people, the tobacco industry is profiting, and they're finding avenues into communities, and I think in large part due to continued effects of historical segregation even, right? And where can tobacco companies land, right? Where can those businesses open? There's more tobacco industry and tobacco retailer stores near schools in lower income communities, right? Because that's where they can put up retail shops. So
Mhm.
there's huge systemic level issues, right, that you're touching on that I think are so important to recognize. And so just to say, this is hard and I can still do it, right? And it's still worth it to try because we know that it takes multiple people multiple attempts at quitting. And so each and every time someone attempts to quit, they learn something about themselves and about the process. And so, it's really kind of an ongoing, and that's how I view it and how we treat
Mhm.
patients in our clinic, is an ongoing way of support, an ongoing conversation, because it can be hard when people sometimes feel like, well, I've tried everything and I've been unsuccessful. And then they just feel like it's maybe not worth trying again. So knowing that there's always every time you try, you're more likely to, have all that information, all that experience to make this next try more successful, right? And I think the other piece, clinically that I talk with people about is it's really never too late to quit. That sometimes people feel like, oh, it's too late or I have health issues already. But we know that quitting smoking is really the single best thing that people can do, both for their health today and in the long run. And your body repairs itself quickly. So I always find that really motivating too, that within just 24 hours of not smoking, the carbon monoxide level in somebody's body, and that's that poisonous gas that interferes with oxygen and really impacts the whole body. The carbon monoxide level after 24 hours of not smoking is the same as someone who never smoked. So the body does an incredible job of really recovering very quickly. So there's immediate benefits to quitting completely. And so I always like to just try and remind people of
Mhm.
those
Mhm.
important reasons to do this and let them know about available options for treatment, because I think the other challenge is that most people try to quit totally on their own without
Mm.
any support. And there are good and effective supports that exist out there. So there's a quit line that is run through the state of Connecticut, totally toll free, available 24 hours a day, 7 days a week, to talk one-on-one with a coach and get some support. They also often provide free medication to try, and there's some
Mhm.
really safe and effective medications that can help deal with some of the withdrawal and craving from kind of that nicotine recovery process. So, talking also with your doctor or others about some of these options can be a really great way to get started.
And I mean, let's continue and elaborate there, Kristen. Let give you a chance for a little commercial. I mean, let's talk about your clinic and your research efforts and your interaction with youth. Because I think even regardless of what happens in the next 4 or 5 years, there's young people that are still going to grow into this world. And I do want to talk about this neo menthol. I guess there's some new
Mm.
chemistry that'll give you the menthol if it's not menthol, but it may be just as addictive. But let's spend some more time on the youth and how we can kind of save our youth from being addicted.
Yeah, that's such an important part. And I think that's really where, when we think about all the opposition that's coming with these policies, we're trying to think, well, who stands to benefit from this policy being delayed and delayed and delayed? And it's the tobacco industry, right? Because we know each and every day over 2,000 youth try a cigarette for the first time. And so, you know, knowing also that menthol is one of the most common flavors that is tried in those cigarettes. Cigarettes used to come in a variety of other flavors. And it was in 2009 with the first Tobacco Control Act that all the other flavors were eliminated. Clove, vanilla, a bunch of fruit and other flavors. Menthol was initially put into that same bill, but was removed by lobbyists who were funded by the tobacco industry. And basically the decision was, well, maybe we don't know enough about menthol yet. This was in 2009. So they said, let's do some more research. We'll push the rest of these flavors out the door because they do appeal to you. There was wide and compelling evidence that these flavors are appealing. And so those were all removed from the market, but menthol kind of remained as more and more data has been accumulating. And so, I think we have seen kind of over the time just the impact of these flavors and their appeal to youth. And so, I think we're also seeing a similar parallel with e-cigarettes and other tobacco products on the market that come in a variety of cool colors and designs and flavors. And so, to the extent that these are just overwhelmingly used and appealing to youth, again, just creates a huge public health problem. So, I think being able to talk with youth, we do a lot of outreach within the community and within high schools just to provide information to youth about what is in these products and the effects of them. And we have a number of different treatment programs going on too, because we do see a number of youth who are then having a hard time quitting and they do want to quit. So I think, recognizing and providing avenues of support for that is so important as well.
And Christian, elaborate a little bit on just take it one or two steps further, even in terms of your, I won't say clinical trials, your clinical studies.
Yeah, so I have a number of clinical studies that are going on, really helping to gain some community input and insight to support the FDA in these different policies that we're putting forward. So an earlier trial that I did was really trying to understand the impact just of a menthol cigarette ban, the one that we're talking about here. And we were able to show that, if menthol cigarettes weren't on the market, we only had non-menthol, even just as a starting point, people had lower nicotine dependence. They were more likely to quit. They were more motivated to quit. And so we published this evidence, we provided it to the FDA, and it was actually put in the ruling that has gone forward as part of the legislation. So, the scientific evidence and the input from the community is so valuable to informing these policies.
Yes.
And we have some other ongoing projects right now trying to understand from the adult side, kind of the other side of this, right? Because and I think it might be helpful to talk about, just the variety of tobacco products, right? We talked a little
Please.
bit about e-cigarettes. And the FDA's goal here with e-cigarettes is they're really regulated like a tobacco product. There's really two different pathways, perhaps, that an e-cigarette could come to market. So one is the Center for Drug Evaluation and Research. That's really the medical pathway. And there, the product has to be determined to be safe and effective. No e-cigarettes have gone that route. The other route is the tobacco product, which is what we were talking about. And there, since we say no tobacco products are safe, right? So they can't meet the safe and effective determination. So the question there about the tobacco product regulation from the FDA standpoint is, are these products appropriate for the protection of public health is what they determine. And so they're really looking at the risks and benefits to the population as a whole. So the users, the non-users, and there have been over 20 e-cigarettes that have met the FDA standard and are available on the market as a marketing approval, saying that they do meet this public health standard. And what I think is important to note is none of those are in a fruity flavor or a child-friendly flavor. Those are only tobacco flavor e-cigarettes. And so they're really trying to strike the balance of saying, we don't want any youth or non-smokers or people who don't use tobacco products to want to use or want to get started here, right? But there might be some people who find an e-cigarette to be a really helpful substitute to help them stop smoking. And so, I don't think that's really the public health challenge here. I don't think the tobacco industry has that same mindset, right? They're targeting, their ads are so clearly with the goal of trying to get as many new people to try these products as possible. And so again, I think that's where like the push-pull of the industry versus the regulation comes in, right? Where we have to limit the manufacturing and the advertising and really say, no, only these flavors should be allowed because they are not appealing to youth and they might have a potential benefit because there has been a lot of research coming out showing that people who smoke cigarettes who are able to stop smoking completely by switching to an e-cigarette reduce their toxicant exposure, reduce the number of carcinogens. So we would never say e-cigarettes are safe, right? We don't want youth or non-smokers to use them, but they might be safer and it might be a transition point for some adults. And so that's some of the work that we're trying to inform too of, how can we help people who are otherwise having a really hard time quitting the most deadly tobacco product? How can we help them improve their health? And then also going the next step, how do we help them get off of the e-cigarettes as well, right? We don't want people to be using these long term because, you're still inhaling chemicals and irritants and there could still be respiratory consequences and things. So it's really a big area of ongoing work.
And Kristen, just take that a little one or two steps further, if you would, in terms of smoke shops and then the young people like vaping and hookahs. So, I mean, there's these other alternative roads of despair that people might be treading down.
Yeah, exactly. So yeah, again, I would just emphasize that for youth, people who don't use tobacco products, there's absolutely no safe tobacco product. And inhaling any of these products, there's chemicals, there's irritants, all of these flavors in and of themselves have a number of chemicals in them, many of which have not really been evaluated in terms of their safety for being inhaled. That's kind of all new research that's being done now that these products exist. But all these flavoring chemicals were really designed to be put into food and things like that, right? They're not designed to go and be inhaled deep into your lungs. And so that's really where we see, other respiratory problems and concerns for youth or young people, who are noting that they're having a hard time doing sports or doing kind of their day-to-day activities. So there are real consequences of using these.
Talk to me about Kristen, rather, where does your optimism lie to still stay on this path? Because I'm just continually impressed. I mean, you mentioned the word systemic, and although this is my show, I don't like to impose my editorial beliefs, but when you say systemic, in some people's mind, that means systemic racism. They see another word connected with systemic, and it's so treacherous to play the race card given today's climate. But it's been this today's climate in some ways has been since 1619 or before. So I'm just curious where, as your profession, your peers, because you've mentioned you've it influenced public policy by regulations, including your work, but still we have a president as we speak who is delayed. And I think the FDA proposed, was it a year ago, 2 years ago that they proposed it? And I'm obviously going to, I shouldn't say obviously, I'm going to vote whoever the Democratic nominee is. But separate from that, I'm still intrigued with where researchers, people that are, you're a public servant as far as I'm concerned. What keeps you in, if I can say, if I can use a metaphor, in the tobacco field?
Yeah.
And people talk about King Cotton, but it was King Tobacco before initially. So this issue of plantations and economics and cultivation and marketing and sales, and then now to see its ugly head being raised upon some people is just really disturbing.
Yeah, absolutely. And I haven't given up the fight because there's still a lot of fight to be had, right?
Good.
And I think for me, it comes back to just the staggering numbers of, when you realize that over half a million people, I should say, in the US each and every year die from a smoking related cause. And that it's fully preventable, right? That this is just a huge opportunity, and a huge need within our community and our public health, of an area where we, can do a lot of good. And so, for me, I also try to break it down to, like, well, what else can we do, right? So we've put the evidence out there. We'll continue doing this work. We like doing community engagement, community listening sessions. So, I love kind of talking on these platforms as well to reach people, but we'll do smaller group sessions within communities to understand what are their concerns, what do they want or need, right? I think there's some opportunities here to think about, if this policy goes into effect at the federal level, what else do we need to be ready to do at the local level to support people
Mhm.
when this goes into effect? How do we help them
Mhm.
get all the access to resources so they can quit and use this as a really beneficial movement? And also, what can we start doing at the local level with policy, right? So we don't have to wait for the federal law to go through. States have also put these laws into effect. And so there's ways to get involved and to, talk to the legislators, knowing and looking at who do you want to vote for. None of our Connecticut leaders have taken money from tobacco industry, but, to the extent that you've got a lot of people in other places listening to this, look at
Mhm.
who's taking the money from the
Mhm.
tobacco industry. And do they have your best interest in mind when you're voting them in, and knowing that the impact that they're going to have on the public and the public health, I think, is important.
And their sons and their daughters, their friends of their sons. Kristen, talk a little bit about, because I've heard, and just correct me I'm wrong, or elaborate perhaps on this. Even if menthol is not off the market, there are new neo-menthol or menthol synthetics kind of thing kicking in. So it seems to me that the industry, again, is still looking for loopholes or market expansion or specific formulations to still kind of disseminate their poison.
Yeah, exactly. So, and I think that's where, as public health advocates, to kind of be mindful and aware of what the tobacco industry response could be. And we've seen this in states where menthol cigarette bans have already occurred or other places, so that we can, provide education and resources and tell people about these tactics so that they can be informed. So what you're describing is what we've seen are, and I'm not going to do the marketing for the tobacco industry, but basically as a loophole. So instead of putting menthol into these cigarettes, they're providing a different cooling agent. So it's a synthetic, a chemically created cooling agent that has a lot of the same properties as menthol. It can sometimes even be more potent in terms of like the cooling effects. It reduces the irritation and the harshness when somebody is smoking and inhaling. And so they're marketing these as non-menthol. They don't have menthol in them, but it's obviously a huge loophole in the sense that it has all the same effects, and can really just be a substitution product and something that somebody transitions to. And it can be marketed that way, as like, you used to use this product that we're not selling anymore, and here, come use this. And
And
so rather
just as
than Mhm.
and just as addictive.
Absolutely, yep,
Okay, continue,
and just as
please.
harmful because it still has all the same carcinogens, toxicants that's in a usual cigarette, right? And so that's really where all the harm comes, from the cigarettes, like all the carcinogens and the over 7,000 toxicants that are being inhaled into the lungs that really affect every organ in the body. No cigarette is a safe cigarette. There's no safe amount of cigarettes, to smoke. So I think being aware of these tactics, and knowing, that this is really just another strategy to try and maintain a consumer base and to try to poison people with this product. So to really not buy into that and to not fall for those tactics, will take a lot of education and public health advocacy, I think, to raise awareness about this.
And Christian, thanks for that clarification. And not that obviously you may be a lawyer. I don't know. I mean,
No.
you're a talented person, but why can't the FDA's the similar proposal to ban menthol? Why can't the FDA propose a ban on these new synthetics?
And it absolutely could. Yep.
Oh, it absolutely
And there
could.
are
Okay.
other countries where that has been done, where they put a ban on cooling agents, or there's different ways to kind of write the legislation and the law. So we'd have to really see what the final document is and what all is included when this does go into effect. But we have seen, at least the way that things have gone in Massachusetts and California. The way that those laws were written, there appears to be this loophole, where these other synthetic cooling products are out there. So it would be something to think about, for other states or localities that are trying to put some of these policies into place to make sure that these loopholes don't exist, and to kind of quickly enforce if things like that do show up in the market.
That's great. Let's take another as we close for another five minutes and take a deep breath. And you covered so much. What kind of jumps into your mind if you could wave if you were the king, queen, he, she, whatever. I'm always amused by this pronoun use. But if you were the hierarchy, if you were the grand poobah, what would you like to see happen in this regard?
Yeah, absolutely. Well, I think the scientific evidence is very strong in support of this menthol cigarette ban. So, I'm hopeful that we can get it through. And that's not to say, I know probably the first thing that will happen will be a lot of lawsuits from the tobacco industry, again, trying to delay this. That's what happened in California, even at a state level when these things went in. But, I think to the extent that we can continue providing really strong scientific evidence, that's really what's going to be needed to stand up in court. And so, I think continue with the good fight
So,
and continue sharing this knowledge,
so,
because I think
so, so
knowledge is power
no,
here.
and it's so in our last 3 or 4 minutes, Christian, I'm so glad. So talk to me about your colleagues. What are you researching, working on, developing? I mean, in a perfect world, I would put you out of business, right? I mean, no more cigarettes on the market. You have nothing else to do. But until that time comes, what are you guys kind of up to? Because oftentimes people are, and you've made it very clear that you have not been imprisoned in your ivory tower. On the contrary, you've been going to the barricades. But from a research standpoint, and study standpoint, what are you guys up to in this regard to kind of help us?
Yeah, so we have ongoing studies really, like I said, trying to provide more supporting evidence, especially around the question of what can e-cigarettes do and potentially what flavors do we want to make sure that we restrict, so that we're not appealing to youth. Because as I said, we have those few e-cigarettes that have gained approval, but there's a number of other e-cigarettes that exist on the market.
Okay.
So we're doing some research to better understand youth use of these products and how to help them quit, as well as providing evidence for, in the case if there are adults who want to use e-cigarettes, knowing how they can use them safely, I think is
Mm-hmm.
really important, because I
Mm-hmm.
think that's where we really have the target audience all wrong with e-cigarette products. And I think where so many people get stuck is that they're using an e-cigarette and a cigarette kind of at the same time. And we see that there's really no safe level of cigarette smoking. So a lot of the work that we're trying to do is to provide that education and evidence to say, if you're going to switch, you have to switch completely from a cigarette to an e-cigarette to really see any of those health benefits. And then, as I said, how do we help people transition off of that, right? Transition off of the e-cigarette, because I think all of those steps need to have some good evidence and some good support so that we're giving people the right information to use these things. I worry sometimes with just the proliferation of all these things on the market, and people are just picking things up and they don't know what's in them and they don't know how to use them. And so
So
there's
should there be more public interest commercials, or would you want to do your own film or a song? I'm just curious from a culture, because we're in some ways we're talking about culture,
yeah.
uh, and so I'm just curious that when you think about your dreams and visions for really having an impact, is it more movies, more commercials, more influences talking about this, rappers? I mean, I'm just curious what kind of Beyonce to sing a song, to do an album on this. I'm just curious what strikes your mind in terms of a really reaching our ultimate objective.
Yeah. Well, how do we reach all the huge audience, that I think needs to hear this? I think that's an important question. Um, yeah, I love those ideas.
Okay,
Do you
all
have
right.
any good songs in mind?
I do have some good songs in mind. Or for you, when you come on the next show, we'll that's a kind of, as we conclude, my kind of
I love that. Yeah.
trick way of getting you to come back for again. And I really hope that can happen, Christian. Just before we close, technology. I was
Mhm.
looking at some of your background, and you're in terms of the therapy and the discussions and the quit line. But talk about technology a little bit, how that kind of might be impacting, or even AI, if you want to go that far. That far.
Yeah, very cool. Yeah, I haven't done much in terms of AI research yet, but I do think technology has a good opportunity to reach people, and people who might otherwise, not want to talk to their healthcare provider or might not have ready access to a healthcare provider. So there's text message support that can help people quit smoking, for example. And everybody's got a phone, everybody's kind of tethered to something. So, I think kind of thinking about the ways, where can we reach people in their communities, in their homes, in those places where they also most need the support. So that's where I like to think about the use of technology to just better expand access to care and to effective treatments.
So patches or monitoring systems, that are those possibilities?
Yeah, so there's different medications. Yeah, if you're thinking of
Okay,
like the nicotine patch, the gum, and the lozenge, those are all available over the counter. So you can walk into any local pharmacy and pick those up as a really safe and effective medication to help people quit. So if somebody's looking for a medication or a way to quit, we always want to recommend the first line treatment. The most effective and safest are the FDA approved treatments. So
good.
those would be the things like the nicotine replacement, or there's 2 prescription medications that can be obtained from a doctor.
Excellent. Excellent. Thank you so much. I don't want to say this has been great. I mean, I've always enjoyed chatting with you, but we're just going to keep fighting
Yeah,
I wouldn't say even fighting the fight, just spreading the love. I think we need to just even work on our language. It's a love of people, and let's all lives can be saved,
yeah.
uh, in spite of some system issues. Thank you so much. Appreciate it.
Thank you.
Have a great day.
You too. Take care. We'll talk soon.
Yeah. As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up, yeah.
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home